Every year, millions of people are impacted by hurricanes, and islands, such as those in the Caribbean, are especially vulnerable to severe impacts. Identifying where resources and personnel need to be sent within affected areas to help the local populations is a core part of the disaster response effort. To address this need, HSR Health has developed, through the support of the Open Geospatial Consortium's 2023 Federated Marine Spatial Data Infrastructure Pilot and Pilot Sponsor UK Hydrographic Office, our Hurricane Health Risk Index, which has been tailored for Anguilla, the Bahamas, and the Commonwealth of Dominica. The Hurricane Health Risk Index identifies a priori the underlying health and social conditions of the population impacted by a disaster and informs emergency response organizations, local and national governments, and public health agencies and world organizations on the locations of vulnerable populations across the impacted area, providing insights on the most effective allocation of resources and response personnel to address the disaster. Shown here is a map of the Hurricane Health Risk Index for the 3 island nations, along with the storm track for Hurricane Maria, indicating the regions of relatively higher risk and where resources may be more at need. The underlying health and social data of the population is included in the layer as well, as shown in this pop-up. The Hurricane Health Risk Index can be combined with other indicators such as the Storm Surge Severity Indicator from fellow pilot participant GGIS, which can aid in further resource and personnel allocation. The Hurricane Health Risk Index is calculated through a weighted combination of the health and social characteristics of the impacted population. The at-risk populations are defined through greater risk of having negative health outcomes during and after a hurricane and include those with difficulty with mobility and those requiring regularly scheduled care such as dialysis. The data for these factors was sourced from the Anguilla Statistics Department, the Bahamas Department of Statistics, the Dominica Central Statistics Office, the World Health Organization, PAHO, the Diabetes Atlas, NOAA, and GATM. We utilized the NAPSIG symbology for the Hurricane Health Risk Index, which was recommended for layers pertaining to disaster response based off of input from FEMA. The primary standards utilized for the Hurricane Health Risk Index include WMS, WFS, OGC Features API, Cloud Optimized GeoTIFF, ISO 3116-2, and GeoJSON. There's a lack of accepted standards for tabular, social, and health data utilized for the risk index. Efforts toward achieving alignment and broad agreement on formatting and standardization of social terms of health data, as well as public health data, should be of value to the industry. During this pilot, we began researching standards relevant to the data used, including ISO 3116-2, ISO TC215 Health Informatics, and HL7. Future pilot efforts should continue to explore standards relating to health and demographic data and data exchange. The Hurricane Health Risk Index is published on HSR.Health's Open GeoMD Platform, which is deployed in the AWS cloud through both an ESRI ArcGIS Enterprise stack and a GeoNode GeoServer open source stack, as well as through other catalogs in the pilot. Each layer for the Hurricane Health Risk Index is available in the Open GeoMD Platform, and when viewing the layer, users can import the layer into their own system through a WMS GET request via the link in the top right. Additionally, the data is made available through an OGC API instance that's shown here. The Hurricane Health Risk Index will remain available on the OpenGeoMD platform as a persistent demonstrator. To expand upon the capabilities of the Health Risk Index, we have also developed a GeoAI component for the indicator that incorporates a decision support AI based on a large language model to provide supplementary information and real-time guidance to emergency response personnel to aid in responding to the impacted populations. We identified how marine data within a Caribbean FMSCI can be utilized to create public health indicators, and this can be further explored in future OGC Marine, climate change, and health-related pilots. Thank you for watching this demo, and for additional information, please visit our website or contact us at impact@hsr.health.